Hi everyone, I'm Erin with Dope Dog, and this month is Senior Pet Month, and we are so excited to have Denise from Hello Ralhpie, a very special guest with us today to talk about and answer all of your questions on senior dogs and aging in dogs. This has been a really hot topic, and I know I have a lot of personal questions around this, so we've gathered all the questions from our community about senior dogs, and we have our vet expert Denise here. So thank you so much for being here, Denise. Do you mind giving a quick intro to everybody?
Yeah, my name's Denise. I live in Arizona. I've been in veterinary medicine since 2002. I was hired with no training at all. They trained me on the job. Worked in Utah at a small animal practice for 4 years, and then here in Arizona for 14 years at another small animal practice. So I've kind of done it all. Decided to do work from home with Hello Ralhpie and quit my clinic job, and I'm just doing this and I love it.
I love it. Well, you're here to answer all of our questions, and we're really excited. So yeah, let's kick it off. We have a lot to go through. And for all of you listening, we're going to cover a lot of senior dog topics, but a lot of things that we can do preventatively. So if you have more of a middle-aged dog, I know my dog's 5 and I'm already like, what can I do to get ahead of this? So I think there'll be something in here for everybody. All right. So we're going to kick off with, this is a great one. So how do you know, is there an age that you are officially as dog senior? What would you say?
There's kind of an in general age, and it depends on the breed. Large and giant breeds have a shorter lifespan, so they're considered a senior at about 5. Your medium and small breeds is about 7.
7 for small breeds?
For small and medium, yeah.
Okay.
I think it's a hard and fast number, but that's about where we use.
Oh, that breaks my heart because I'm thinking like 10, but no, it's way earlier. Oh gosh. So would bigger breeds be considered? I have a 11-year-old pit bull, so he's a large breed, so he's well into being a senior. Medium, okay.
Large breed, you're talking about more like Great Danes, Saint Bernards.
Okay.
Poodle. Got
it. Okay, so any dog, so between 5 and 7, your dog could be considered aging. So how can we, if we're aware of that, obviously most of us know around when their dog is born. I know even with rescues, it's a little difficult to know exactly, but generally, if you know your dog's like between 5 and 7, what signs should you look out for, or what risk might we be seeing as our pets age?
The top health problems with senior dogs are cognitive dysfunction, which I believe we'll talk about more later, arthritis, and cancer. You can also have kidney disease, heart disease, eye problems like cataracts, something called lenticular sclerosis. It's just a thickening of the lens. So if your dog's eye looks cloudy, don't immediately assume it's cataract. It can be a normal aging change.
So we just learned that some of the common signs of aging in dogs are similar to humans. So that's kind of a good benchmark kind of for me. And so knowing this, our next question is around how often do we need to bring our senior dogs to the vet? Is it going to be more often than our younger pups?
Definitely. Rather than an annual exam, you'd preferably do every 6 months at least.
Okay. And do the vets preemptively know that, or should you as a pet parent be seeking that care extra? I wonder if, or how do you do it at Hello Ralhpie? I guess.
Most vets are probably only going to remind you every year. They won't necessarily remind you every 6 months. So you may come in and say, okay, we'd really like to see you back in 6 months for another wellness exam.
Okay, but if not,
you really get a reminder in the mail. So it's more to keep up with it.
Okay. So it wouldn't be weird if you just told your vet, I'm going to start coming in every 6 months now.
No, we have at my clinic. We have clients that would do that.
Okay. And then once, if we do bump it up to every 6 months, how does a senior dog exam look different than a normal exam? Are they going to start texting for a little bit more than they normally would?
Absolutely. Probably the main thing you're going to see is they'll want blood work. So starting at your senior age, like 5 to 7, they'll want to do a baseline, because it can be called a senior panel or senior wellness, just to check their organ function, their blood glucose levels, just basic things, blood chemistry. And after you have a baseline, they may want to do it every year, just to see if anything's progressing. If you can catch things early, all the better.
So our next question is a question that I also have. Our dog James he's a little slower. It seems normal. Nothing out of the ordinary. But how do you know if that's normal? If it's just a normal sign of aging that your dog doesn't want to play as much, or when do you know to be concerned?
Some slowing down, especially physically, is going to be normal. They may have arthritis. They may have, they're just more tired.
Denise, I can't hear you at all.
Uh-oh.
I think your mic turned off.
Let me see. Mic. Audio.
I can't hear you.
Let me try now.
Let me see. Now I muted you. Now I unmuted you. Can you hear me still?
Yeah. Can you hear me? No?
Okay, now I can. Did you make a change?
I just switched microphones and switched back to the original one.
Okay, I can now hear you. That's so weird. Okay. Sorry. I'm just going to take that one.
I love it. I love it.
I'm going to take that one from the top. Okay. I'm literally not going to move and touch anything.
Okay, so
our next question,
down, if it's normal or
yeah. Okay. So, Denise, our next question is a question I personally have. Our dog James, like I said, is 11, and everything he does is slower. So, is this considered normal for an aging pet? And when should we be concerned with our dogs just not wanting to do as much?
So, some physical slowing down is normal. They can have arthritis. They don't have the energy they used to. Mental slowing down, you might see they might not respond to a command as quickly. But it's kind of like their brains are actually similar when they get dementia to humans. So it could be like you can't find your keys, you misplace things, yeah, that's normal aging. If you don't know what your keys are for, then that's something to be concerned about. So there are specific things that will kind of tell you that dementia is going on.
Okay, and that's leading me into my next question. And I'm glad you said we always think physical with aging, or at least I do, and the mental aging is probably even more tough for the dog and for us to understand. So on that note of dementia, how can you tell? Like, what are the signs specifically that your dog might be struggling with doggy dementia?
Well, there's a whole acronym that describes.
I love acronyms. That helps. It's
DISHAAL. The D is for
DISHAAL?
Yeah, I don't know how to pronounce it. I just read.
Okay, DISHAAL.
But anyway, the D is disorientation, where they're not sure where they are. They're getting stuck in a corner. Don't know which way the door opens. Don't recognize you. I had a cat with this issue, and she would go to the cat door and sometimes go through, and other times just sit there like, I have no idea what I'm supposed to do here. So
disorientation.
Yeah. Okay. The I is for social interaction. They can be more clingy. They can be more fearful, more irritable. It can be aggressive towards other pets that used to be their friends.
So a change in social,
right.
Whether it's more or less.
Right. Just something that's not normal for them.
Okay.
The S is for sleep and wake cycles. They can be sleeping all day and then awake and restless all night. They can be pacing at night, just can't sleep, vocalizing. Onto the H is for house soiling. They can somehow not realize that they're supposed to ask to go out and they're peeing and pooping in the house. Or they're taking longer to realize, hey, I need to go out to go to the bathroom, to let you know.
On that one, how do you know? I understand if they're like, maybe not mentally all there to tell you, but is any of that sometimes maybe like a bowel issue, or like they just kind of lose control, or like can't hold it in as much? It could be either, I'm guessing.
Yeah, a lot of these things you want to check with your vet and just rule out, is there a medical problem causing this, or is it cognitive dysfunction?
And when it's cognitive dysfunction, there's not much to do. I guess we'll get to that later.
Yeah, we will, because there's more.
Okay. All right, back to the acronym.
Yeah, A is for activity. They can have increase in activity, like I said, be restless and pacing. They can have a decrease in activity. They're sleeping more. They don't want to interact with you. Don't want to play, that kind of thing. Also with activity, you can see like a repetitive behavior, like circling. Here's my cat wanting to participate. I just went blurred again. Am I blurry again?
Yeah, maybe do the on-off.
I bet my cat did that.
See, this is why we don't do it live. You're back. Yeah.
She must have hit something. I don't know. She's walking around under the desk.
Increased activity.
The second A in there is for anxiety. They can get anxious, stressed, more separation anxiety. If they never had it, they might have it. If they had it, it could be worse. They could be more fearful and reactive to things.
Yeah, that's one we struggle with at all the ages, in this household at least.
And the last letter, the L, is for learning and memory, meaning they forget the trick you taught them. They forget the command to sit, to stay, whatever they've learned. It's like, I just don't really remember how to do it anymore.
Okay, so knowing the acronym to kind of keep an eye out for all the different things that could happen that kind of point to that is really helpful, but also really sad. How is this for the dogs? I mean, having doggy dementia, I know it's inconvenient, but is it harmful to their daily life, or is it just a natural sign of aging?
It's hard to know how it is for them. Like with my cat, I think it was harder for me to watch him, but definitely can affect their day-to-day life if they have a good house buddy that they suddenly don't like anymore and find annoying, if they can't sleep at night, if they don't know where to find their food, that kind of thing. So
they need to be a little bit more guided, watched by us as the pet parent. We have to step in.
Yeah, they can have less interest in their food, so they're not eating, and that's not good. So. Yeah,
it's so sad. What can we do? I'm noticing some of these things in our dog, James, just a little hint of it, and it breaks my heart. How could we slow this down if we get ahead of it?
Some things that can help. There's not like a cure-all, but start now with mental stimulation, brain games, food puzzles, that kind of training something new. There actually are supplements that may or may not help. You can talk to your vet about that. There's omega-3 fatty acids are possibly a help. Some like vitamin C and E, antioxidants. But yeah, your vet should be able to guide you with more information on that.
Got it.
Physical exercise is good too. You know, even though they're going to be slower, at least doing something.
Yes, get them out, get them doing something. That's a great segue. We're actually going to go into a little bit more about the physical aspects of aging, so we can cover the exercise, the arthritis. So how much exercise does my senior dog need? They want to lay around. I know James wants to lay around. We take them on so many walks, but what would be ideal for dogs for exercise as they get older?
There's not really a set number, like, okay, every dog needs, 30 minutes, 60 minutes a day. It's going to kind of depend on what their physical condition is, things like the weather and the surfaces you have. But if they can't go do a 30-minute walk, you can try like a couple of 10-minute walks, a couple of 15-minute walks. Just break things up into smaller increments so they're not getting tired.
Keep them moving any way you can, I guess.
You can try swimming. If you have access to a pool, swimming is good.
Well, that's a good one. Yeah.
It's very low impact.
And if they do need to cut back for any reason, if your dog is maybe recovering from something or they just physically can't as much, how can you, is there anything else you can do if you've had to cut back on activity to help keep them healthy?
I was having a hard time answering this, so I asked my vet friends on Facebook.
Oh,
and my vet
crowdsourced.
my vet student friend said, number 1, prevent obesity. Number 2, prevent obesity. And number 3, prevent obesity.
If you're not moving as much, lower the calorie intake.
Right.
That makes total sense.
Talk to your vet. Hey, this is how active my dog is or can be. Do I need to drop their amount of food? Do I need to switch them to something else?
That's a big one. And it makes a big difference. We actually cut James's, we were feeding him a little too much, or we played around with the dosage because he had that little extra belly, it went out, not in. And within a couple months, he leaned out really, really significantly. Like we could tell, and you could tell he's lighter on his feet. So I think that's a huge one, especially if they can't be as active as they used to. Okay, so
better on their joints too.
yes, and on that note, so yeah, keeping them lean in order to prevent things like arthritis. So in senior dogs or in any age dog, what are some of the signs of arthritis that we can look out for or be knowledgeable if this is something our dog might struggle with?
The first thing people will usually mention, clients that come in, they'll say their dog has a hard time getting up from lying down, like first thing in the morning. They'll have a hard time getting up. Or they'll have
specifically in the morning?
Down. Or if they've been lying down for a while, just getting up from a lying down position.
Okay. So again, kind of like when I'm getting older, another human corollary.
Yeah, they can be stiff when they walk. You can have lameness, depending on where the arthritis is. My cat that had cognitive dysfunction also had bad arthritis in his hips, and so he couldn't no longer jump up on the bed. If they used to just hop up on the couch, and now they're kind of like don't want to do it.
Yeah. So the next question is a great one. We did this. So we had, like I said, I keep talking about poor old James, but we got our puppy Zoe, and we always say, oh, she keeps him young. She runs in circles around him and actually kind of annoys him sometimes. What are your thoughts on getting a puppy to keep your older dog active and youthful?
I think if that's the only reason you're doing it, it's probably not a good idea.
Oh, was it?
Because your old dog might not like change. They might find the puppy annoying and stressful.
Yeah.
If you want a puppy anyway, you can consider, does my dog like other dogs? What's my dog's personality? What's their activity level? And it can work. I mean, Obviously, it sounds like it's worked for you. So
yeah, like if the dog's fine with it, like it can't. Is it more of a positive if the dog is happy with it? I guess is the question.
It can be.
My personal question.
One of my vets suggested that when I was asking random questions to my vet friends, and she said, "Yeah, you can get a younger dog to kind of get your older dog more active." So
I think it does help. I think it entices him to play more, and then just as the parent, I'm mindful of like, okay, give him a break now, like lay off. So just monitor it, like not too much fun if they can't handle it.
Right.
So if you don't want to get a puppy to keep your dog young, what else can we do to help dogs that might be struggling with arthritis or hip and joint pain?
There are supplements we'll usually recommend, like a glucosamine chondroitin supplement. There's one called Dasaquin, Cosequin. Those are pretty popular. A lot of vets will prescribe them.
And how early can we start those?
It's not going to hurt to start them, as old as your dogs are. What did you say, 5 and 11?
Yeah, 5 and 11. Yeah. All right.
There's an injectable, they call it disease-modifying drug called Adequan. You can actually get that. It's prescription, but you can actually give it at home, an injection, and it basically reduces the cartilage loss.
Yes, I've talked about this. We had a segment on arthritis about once you lose the cartilage, it's just gone. So what does this shot do? It slows it you can never rebuild it, right? It's just slowing it? Or how does that work?
Yeah, I can't remember the exact chemical action, but it's supposed to inhibit the loss of more cartilage.
Okay, that sounds good. That sounds promising.
It works for a lot. Not everything's going to work for everybody, but
and can you say the name of that one more time?
It's called Adequan.
Okay. And then what is glucosamine that is more prevalent? Like, how does that one work differently, that supplement, glucosamine versus
I'm not actually sure how those work. I didn't get into
the
that.
Glucose. Because I know it's not a shot. It's usually, as a powder or whatnot.
Yeah, it's a chewable or tablet.
So maybe just a slower burn versus like targeting a particular area.
Generally, we would start out with something like the joint supplement. If that's not working, then we'll move on to like the Adequan.
Okay.
Pain medications are always a possibility. You can do rehab. One of the vets where I used to work is certified in canine rehab.
Oh,
And
wow.
we'll do range of motion exercises with you, massage, stretching, that kind of
Yeah, I feel like sometimes a combination of all of the things that, is really what's going to be the best package. And then you don't really know what it was that worked, right? Maybe all of them together.
Yeah, start with one and work from there.
Speaking of tough questions, so I'm going to wrap it up here with a pretty crazy statistic. Almost half the dogs senior dogs will have some type of cancer in their lifetime. I know we hear a lot of it here at Dope Dog. A lot of our products are used for dogs that are kind of easing pain related to cancer. So how can we know, as it relates to aging, if the lumps and bumps that we might see, how are we going to differentiate which ones might be cancerous and what should we look out for?
My opinion is any new lump that you see on your dog is worth having your vet look at.
Okay.
Especially anything that suddenly comes up and is growing quickly, anything that looks like it's ulcerated and bleeding, irritated. But I'm kind of the err on the side of caution and, oh, hey, here's this new lump that wasn't there. Go have it checked out.
And is this something, I know at the dermatologist, they kind of do like a little map, a chart to keep track of these things on humans at least. Is that something most vets do, or is it something you can ask for to kind of on your 6-month checkups as your dog's older? Can you ask for like a map of their moles? Well,
I think that's a fantastic idea. I've never seen it done, but I think it's wonderful.
Oh, good. Well, I'm going to request that for my vet.
Yeah, do that.
Okay, cool. And then what can we do preventatively for maybe our younger dogs? Or, I mean, I know a lot of times cancer is inevitable, but any tips here on, just living the healthiest life we can early on?
It doesn't hurt to just keep their overall health up, feed a good diet, exercise, just keep them healthy in general. Spaying female dogs can reduce mammary cancer risk.
Okay.
If you've got a white dog, limit their amount of time in the sun or use sunscreen because they're more prone to skin cancer with the light.
I've heard that. Is there dog spray sunscreen that might work?
There actually is sunscreen for dogs.
Yeah, no, I know there is. I'm hoping it's a spray.
Yeah, I don't know. I was looking for some for my light colored cat because I thought, oh, maybe I better be putting some sunscreen on her ears at least.
Got it. So a lot of it, again, like I put sunscreen on every day. So thinking in terms of your own health with your dogs, I think can lead you to a lot of really good proactive steps.
Right. The only other thing I came across was secondhand smoke is potentially related to lung cancer in animals.
In dogs.
Really? I didn't read that it was 100% certain that it's going to happen, but that it's a risk factor.
Yeah, I mean, I guess that makes sense. That's really alarming. Gosh, who smokes anymore? Okay, so protect your dogs from all the elements, including toxic, smoke and the sun.
Pesticides and stuff. Keep them locked up. Keep them.
Yeah.
Just be on the safe side. Anything that's chemical, try and keep it away from them.
Well, that was really helpful. We covered a lot. Thank you so much, Denise. I hope everybody learned a little something about aging, what we can do now to help prevent some of the common things, and just do right by our dogs. So I really appreciate your knowledge. And if anyone has questions, feel free to reach out. We always go live with you guys, and we're happy to follow up and get some answers from Denise and the Hello Ralhpie team if anyone has any specific questions about their own dog. But thank you, everyone. And happy Senior Pet Month. Giving a big hug to all the older and younger dogs out there.
I love senior pets. They're the best.
They're the best.
They are.
Awesome. Bye, everyone.